Hello guys, Dr. Qureshi here. Today we have a case of Chalazion. As you guys know that I do remove Chalazions or I take care of them with antibiotics and drops and steroids and whatnot. But today I wanted to show you the difference between a stye and a Chalazion, okay? So if you can focus here, this is my lovely patient. We're going to focus on her eye. Perfect. So I'm going to show you what I mean by externum. So if you look at the eyelashes here, if something comes, you can close your eye. If something comes from this area, which is the hair follicle, like the root of it, it will be a stye. And a stye is hordeolum externum, meaning it's sitting externally on this area. But when you open your eye, I'm just going to move this a little bit. Look down. If I invert her lid and you see a swelling, which is not very obvious here, there is a little swelling here on the outside, but let's do the lower lid. So look up. You see a little bump here? It's slight, right? But when I invert it, you see that area in there, which is reddish in color? You see that? Good? That is a stye developing. It's not very big right now, but the whole purpose is to treat it early on so that it doesn't grow in size. Basically, it's inflammation, and then neutrophils, macrophages come and make a big swelling inside the lid. So that is known as a hordeolum internum. So just remember the difference. Hordeolum internum comes from under the lid. Hordeolum externum is going to be at the lid hair follicle area. The treatment is obviously different. Hordeolum externum can be treated with an antibiotic, maybe like a maxitrol, which is neomycin, polymyxin, dexamethasone, which is antibiotic with a steroid. However, the hordeolum internum, which is a Chalazion, you cannot just treat it with this antibiotic or not an antibiotic, with ointment. Why? Because it's not going to affect that area. It's coming from inside, right? So for that, if it's something really big, it's not going away on its own, or with warm compresses, as I recommend 8-9 times or 6-7 times a day, if it's not decreasing in size with that, then I'm going to start the patients on an antibiotic, which is oral antibiotic like Augmentin, 500 milligrams twice a day for 7 or 10 days. And if it doesn't go down even with that treatment, then the last resort is to cut it out. And you guys can watch the video on how surgically I have removed them. But for today, like I said, this is a mild Chalazion. It's coming from inside the lid. It's a hordeolum internum, and I'm going to treat the patient with warm compresses. This is my first line of treatment. The more you do warm compresses with a beaded mask, according to the instructions, it will shrink. And a lot of times it has an opening, so all the gooey, cheesy stuff comes out also. Okay, guys, so watch the video on Chalazion. Thank you.